My name is Ernest Warm, and I am a Winston Salem State University RN to BSN online nursing student. Today, I did a focused health assessment for neurological examinations as part of Group 3. This assessment was focused on the 12 cranial nerves as well as a short assessment on the NIH stroke scale, which is a national assessment used to determine deficits from a patient who may have had a stroke. In today's assessment, my patient was my mother, Debbie Gorham. A background health history is that she is a 57-year-old African American female. She is 5'5", 230 pounds. Her current vital signs are a temperature of 98.8, a pulse of 104, a blood pressure of 128/84, and respirations of 17. My patient for today has no primary health history. She is a current smoker, and she does have mild bilateral extremity edema. This could be related to her smoking or to hereditary issues, as all women in her family do develop this at a late age. The reason I decided to use the cranial nerve examination as my focus assessment today is because I believe that the cranial nerves can tell a lot about what is going on with the patient. Many patients can come in with lightheadedness, dizziness, abnormal gait, the inability to taste certain things, and these can all be contributed to many ailments. However, when you do a quick and focused cranial nerve assessment, sometimes you can minimize tests and expenses that have to be done because you can determine exactly where the problem lies. A lot of times, when patients present with these such ailments and a cranial nerve is not functioning correctly, you can determine that this is a brainstem problem or that lesions or trauma has occurred and that synapses are not functioning or connecting correctly. I do hope you enjoyed this assessment and find it a great learning opportunity. Thank you. Good afternoon. My name is Ernest Gorham. I'm a BSN nursing student with Winston Salem State University, and today I will be covering the cranial nerves of a neurological exam. Today, my patient will be a Miss Debbie Gorham, who does provide her open consent to use this video for curriculum purposes. Is that correct?
Yes.
Thank you. So to begin a neurological exam, you always do assess the patient's alertness, in which my patient is alert. You will also determine whether they are alert and oriented. To do that, you ask four simple questions. First being, who are you and what is your name?
Debbie Gorham.
Right. And what is today's date?
11/28, 2017.
And who's the current president?
Donald Trump.
And why are we here today?
For an assessment for school.
Thank you. So my patient is what we would call alert and oriented times 4. That is alert to person, place, time, and situation. So we will dive right into the cranial nerve assessment for a neurological exam. To do that, we will assess the 12 general cranial nerves, and I will try and do it in a systematic order. The first cranial nerve is smell. That is the olfactory nerve. So to do that, it's very simple. You have your patient close their eyes, and then you will get an item and let them smell it and see if they can tell you what it is. So for that, we will be using this. And can you tell me what this is?
Peanut butter.
Correct. So today's item that we used was a cracker painted with peanut butter. So the next set of cranial nerves that we will discuss are the second, third, fourth, and sixth cranial nerves. Those are the optic, oculomodal, trochlear, and abducent. These cranial nerves control the vision and eye movements. So to do those, I will check perla, which are the pupils equal in size, round, reactive to light, and have perfect accommodation. So to do that, I will take my pen light and I will gauge if the size of the pupils react to the light, in which they do. And while doing this, I can also see that my patient's pupils are perfectly round and symmetrical or equal in size. I will also have you check vision by having you keep your head completely still and following the pen light. Perfect. So when I do this, I want to check to make sure that both eyes move, that there's no sudden jerking of the eyes, and that the neck does not attempt to go in the, or the head doesn't attempt to go in the direction that only the eyes are able to move. This lets me see that the eye muscles are intact and work correctly. I will also check accommodation. This is if the eyes can be fixed and differentiate between distances. I will do this by taking my pen light and let you concentrate on that. And you will see if the eyes cross. And in this case, the patient's eyes do cross, showing that she does have good accommodation. The next cranial nerve that we will check is the fifth cranial nerve. That is the trigeminal cranial nerve, which covers mouth and lower jaw movement. To do that, I will have you open your mouth and close it. I'll have you clench down, and I'll feel the muscles to make sure that they do tighten. This shows me that the mandible and the lower jaw do tighten and clench and that the muscles are intact. You can also add into this assessment portion the seventh cranial nerve, which is the facial nerve, and that helps you to determine if the face is symmetrical, which can help with stroke. And it helps to make sure that all of the facial nerves are intact. So by doing that, I'll have you smile, I'll have you frown, I'll have you puff out your cheeks. All right, great. So the patient passed that test as well. The next cranial nerve we'll use is cranial nerve 8, that is the auditory nerve. To do that, you can do multiple tests, some being the Rene test, where you place a little metal device right behind the ear and see if the person hears the ring. For this test, since I don't have that device, I'll do what's called the whisper test, which is you whisper something in the patient's ear and then have them to repeat it.
Peanut butter. Jelly.
Great. So the patient did answer those correctly. The next cranial nerve that we will use is cranial nerves 9, 10, and 12. The glossopharyngeal, the vagus, and the hypoglossal nerves. These nerves control swallowing, saliva, and movement of the tongue. So I will feel here, right up under the patient's neck, and ask them to swallow. Here I can feel that there was a successful swallowing. I will also ask you to open your mouth. And here I can see that her mouth is moist and that saliva is produced. I will also, while the mouth is open, ask the patient to say ah. And here I can see that the uvula does rise, showing that the vagus nerve is intact. The final nerve that we will do in this is the cranial nerve 11, or the spinal accessory nerve. This nerve controls the neuromusculars of the neck and shoulders. So for this, I will have you raise your shoulders together and bring them back down. And then I will put my hand on your cheek and I'll have you push against it as hard as you can. Good. And now the other side. Excellent. So these 12 nerves will give you a great insight to a neurological exam of how a person's brain is functioning. The next assessment that we will step into is the NIH stroke scale. This scale is used synonymously across the nation to determine whether people have had strokes, how fresh the strokes are, and what deficits may be had. There are numerous exams that are used for the NIH stroke scale. Today we will cover two. The two that we will cover are first the drift assessment, which is where we will have our patients stick out both arms, and we will count from 1 to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Great. Now doing this allows us to see that if either of the arms will drift down, this means that there has been weakness on that side, which also means that the opposite side of the brain has been affected. I will also ask her to do that with her legs. Can you please hold your legs up for me for a count of 5?
Both legs?
Yes. Well, you can do one at a time. Some patients, depending on weight or age or general muscle strength, you may have to manipulate a little bit to get through these tests. 1, 2, 3, 4, 5. Perfect. So her right leg was lifted with no drift. And again, we'll do the left leg. 1, 2, 3, 4, 5. And again, no drift. So all of her muscle strength is intact. There are no deficits seen so far with the NIH stroke scale. The next stroke scale that we'll use is I'll have you lay back and you will take your leg of one foot and bring your heel up to your knee, and then you will rub down. Perfect. And then you will do it with the other side. Perfect. Patients that are able to do this also do not have any neurological deficits. They are able to place their heel on the knee and go all the way down the shin to the arch of the next foot. In this quick and brief assessment, we have determined that our patient has not had a recent stroke and that for purposes of this exam, all neurological functions are intact. Thank you.